Great. Well, it is 5:01, so we're going to get started. Good evening to everybody. Thank you all so much for being here. For those of you who don't yet know me, my name's Danica Comey. I've been working at AHEC for a while, but I'm moving more into helping with the AHEC scholars. So I'm excited to get to know you all and get to know a little bit more about what you're doing with the AHEC scholars. So I'm excited that everybody is here tonight. We have two great presenters, or one presenter and Stephanie and a helper presenter from the Montana Public Health Institute. So Hillary Hansen and Stephanie Tesaro are from the Montana Public Health Institute. And Hillary is going to talk about the workforce assessment and the workforce strategic plan. So Hillary, I'm going to turn it over to you, and thank you all so much for being here tonight.
Amazing. I'm gonna start my sharing here. So hello everyone. As was introduced, I'm Hillary Hansen with the Montana Public Health Institute. We're a nonprofit organization working in the public health and healthcare field in Montana. Specifically here today because we are helping facilitate the workforce assessments and strategic planning pieces. So excited to have you here. Stephanie is my partner in crime on this and also my technology partner in crime in case anything goes wrong. She's my backup. So just to give you guys a little bit of context of what we are hoping to do tonight is share with you some of the results of the workforce assessment surveys that we've done and get your feedback on them, like to see if this resonates with you, if there's anything you feel like is missing or that we need to hear. And then I'm going to share with you where we've started to go in terms of strategic planning. And this is strategic planning for the Montana healthcare workforce. And so there are specific student sections as a component of this. And we want to share with you those sections and make sure that we are going the right direction. Make sure we're including what you feel like needs to be included in this work. So I want to start just with a background of how we got here and why we're here. So first off, we know workforce challenges are real. There's probably reasons you guys even chose this are all different, and you're seeing some of these challenges even as you go through your educational pieces. We had a strategic plan that was completed in 2017, but as we all know, there's been a lot of shifting and moving, some of it due to post-COVID stuff, and some of it just due to new challenges the healthcare field is facing. We also know that Montana is really distinct in that we have a lot of those rural areas. And so we know that there's different challenges facing those areas. And so this is where this is coming from and why we wanted to dive into both an assessment piece and a workforce strategic plan. So I want to start, since there's just a few of us here, and I do want this to be interactive. I really want to hear from you guys. I was hoping that folks could just share a little bit, like introduce yourself, share a little bit of who you are, so that we can make this as interactive as possible. So I'm going to stop sharing so we can see each other big screen. And I'll just let you guys jump in. Does anyone want to go first?
All right, I can go first. My name is Elizabeth Johnson. I'm a second year Psych DNP student at Montana State University. I'm taking the scenic route, the 4 years. And what is the other thing? Currently I work with ICE. So I work with detainees at different facilities all over the country. My interest, of course, is to work. I'm in Butte, Montana. I plan to stay here for many years, hopefully to take care of people in Montana and especially here. I worked at the Veterans Affairs before, and I'd love to go back there. Over.
Thank you, Elizabeth. I love that concept of the scenic route. I've never heard that before. I think I took a few scenic routes also in my career. Brittany, I see you're unmuted. Maybe? Okay. I'm not sure if she can hear us. Does someone else want to go? Kevin.
Hi, good evening. My name is Kevin Settle. I go to school at Carroll College here. I'm a year one in the 2-year MSW program, and I've had a long break with a different career, and coming back into it. I'm pretty excited about it. I just started AHEC here about a month or so ago, and it's been nice to hit kind of the weekly uh, trainings. It really helps supplement kind of what we're getting at school.
Great.
And I wish
Thanks.
and I wish I was on the beach.
Yeah, I think we all do. Thanks, Kevin. Burlee. And I'm gonna not do well with names tonight, so correct me.
I'm Briley and I'm a junior at MSU, so I'm doing the nursing program through Billings.
Welcome, glad to have you. Dacia. You're
Hello, everyone. No, that's a hard name. My name is Dacia Debach.
Dacia.
So I know it's you didn't put an R in it, so I'm really proud of you actually.
Okay,
Most people
thanks.
just slide an R right in there. I'm like Elizabeth, I'm taking the scenic route. So I'm second year primary care FNP student at Bozeman. For work, I actually teach. I'm a nurse educator at MSU Billings, the program director for the RN to BSN degree completion program. So it's busy, but I really enjoyed my AHEC classes, and the online platform makes it really flexible, which I really love. But very interested to hear about this work this evening.
Thank you. Welcome. Others on here. I don't know if Brittany can hear us now. Hannah Everlyn.
So sorry, my settings for my microphone was off, so I was just messing around with that for a split
You're
second.
good.
But I'm Brittany Lorente. I'm a junior. I'm studying to get my Bachelor's of Science in Nursing, and I got placed in Billings. But I haven't really decided on what specialty I want to go into yet, but I've kind of had oncology in the back of my mind, but I'm still trying to keep my options open and hoping something will really speak out to me.
Amazing. Thanks, Brittany. Anyone else have microphones? Hannah, yeah.
Yeah, I'll go next. I'm Hannah. I'm a P2 in pharmacy school at the University of Montana. Super new to AHEC, but I'm very excited to be here.
Thank you. Evelyn, we'll come back to you now.
Okay, hi everyone. My name is Evelyn, or you can call me Eve. I'm a graduate student at Montana State University. This is my second year, and my interest is in rural health and public health since I'm doing community health. I know it's interesting to be here. I also work with, not as work, I'm a scholar for AHEC. I do some classes there, and I'm excited to be here.
Thank you. Welcome, everyone. I know we also have Alexis and Katie here who are both with AHEC. I don't know if either of them want to go for the introduction. Alexis?
Sure. Hi, I'm Alexis Tobin. I'm the director for the North Central Regional Montana Area Health Education Center. Supported this project from the beginning, so just really excited and grateful for your feedback today. Thanks for being here.
Thanks. All right. I'm going to move us back then to our presentation. Let's see if I can get this right here. Thank you everyone for taking the time to introduce yourself. I think it just helps us know who's here and what input we're bringing to the table. So I want to move to the assessments that we completed and tell you a little bit about the key findings that we found. That made no sense, but you got it. So there was 2 surveys that were completed as part of this assessment. The first one was specific to post-secondary education partners. And it was a 2-prong approach with interviews first of some key stakeholders. And those folks really gave some initial feedback and helped develop the questions for the surveys. And then surveys were sent out to post-secondary education schools. Likewise, on the other side, we had workforce assessment. So this was folks that are working right now in healthcare. We had stakeholder interviews to help us define what is the information we want to gather from folks, focus groups. And then the survey was sent out through the Montana Hospital Association. So it was sent to hospitals, critical care, etc. And on that, there was both administrators and the medical professionals that completed that survey. So the post-secondary education partner one, we had 10 interviews completed and 34 school education post-secondary partners that completed it. So just to give you a little idea of who these responses came from, so you can know where their thoughts might be. We had representation from the South Central, Western, and Eastern AHEC regions. Most of the folks who completed the survey were associated with a 4-year educational institution. And then here's just the offerings that those educational institutions have. So this is a super short 1-slide summary. I'm going to go over a couple of the pieces, but some of the things this group and survey identified related to the barrier and challenges. Number 1 on entering the workforce was just making sure folks have that professional readiness and that job readiness, and also rural readiness. So recognizing that urban versus rural has to be taken into consideration. There was the piece brought forward of it's a barrier to get those rural opportunities, and there might be more that needs to be done to make sure as you all are going through your education that you have that opportunity. There's also a need to support students in developing those soft skills, those communication, problem solving, things like that, along with strategies to manage stress and burnout. Feedback was that a lot of times school can be super stressful, and so folks are entering the workforce already a little stressed and burnt out, and then put into a new position that's adding to that piece. So strategies to manage that while they're in school, and strategies to manage that transition as they go into the workforce. Lots of talk about making sure that there's the opportunities for clinical and hands-on experience, again with that focus on the rural settings, and making sure that in that place too, that you also have preceptors and mentors and others ready at those organizations to host. Just because we also ask about AHEC, I want to share with you guys what was said about that too. Lots of folks said, we understand what AHEC is. What we don't always understand is the level of all the programs that they provide and how we could better utilize them. So going into some actual survey results, just to show you these numbers, talking about those needs and challenges. So specifically here, thinking of those soft skills, those interpersonal skills. So this is what you can see here, that between occasionally true and often true, we had about 72% of people reporting that there was more that is needed in terms of training on soft and interpersonal skills. And then on that piece about emotional and mental skills, so thinking about that stress, burnout, how that is managed here. So 68% approximately said often true or occasionally true as a big need here. So both of those really stood out in the results of something that is lacking as we're looking at those different educational programs and as we're looking at prepping students for entering the workforce. I just want to bring forward a couple quotes here because I think they say it better than I could. But around that component of rural readiness is a big issue. And I love this quote at the bottom. Like, it's one thing to work in a 20-bed hospital, and we're often not prepared for like what those smaller hospitals might mean and the difference between them. And so making sure that that rural experience is really provided. Now, on that end, as I stated, there was a lot of concern about actual clinical placements. And so the education partners were asked, is there adequate space for students to be placed in clinicals or hands-on experiences, specifically in those rural and frontier communities? And the answer was not always, like sometimes, but not always. And so knowing that if that's a component that we want to improve upon, there's going to need to be some work put into making those opportunities available. The second assessment that was completed was that workforce one. So we had first the interviews with 5 folks and then moving to focus groups and then survey here, as you can see, much larger survey participation because, as I said, it was sent out to those Montana Hospital Association organizations. And so it was workforce that was answering these questions. So things we heard from them. Big successes are happening in recruitment and retention. So lots of folks are finding that they can utilize their own cross-training of staff, utilizing their own grow your own, kind of build people up and move them through different programs. And that has been really successful in retaining people. And also that the pipeline programs are working. So the pieces you guys are even engaged in and that connection from, excuse me, the connection from being a student to moving into the field and how that can help people stay. But there's still lots of challenges coming forward in filling those roles. As you guys probably know, living in Montana, housing particularly was mentioned, as was pay and salary. The interesting part that was brought forward about housing was that some of the things that organizations are doing to try and address the housing crisis, such as providing housing on site, is not always what people want. We heard in one of our listening sessions, even that piece of like, nobody wants to live next door to their job. Nobody wants people at their work to see that their car's in the driveway and they could go knock on their door and ask them to fill in at any time. And so just recognizing there's probably more work that needs to be done as we think about the housing piece and some strategies that might actually work for that. Retention also, what folks mentioned as being some of the most important things are interpersonal. So even who are your colleagues? What's the culture of the organization? And also helping find that work-life harmony with some scheduling factors, with flexibility and other components coming into play. We heard that some of the hardest to fill positions at these organizations were within the medical professional and allied health field. And while folks knew that there was access to higher education institutes that may be able to help that grow your own piece, there was fewer than half that actually were engaged with a higher education institute. So just want to share with you what we heard as some of the most effective and least effective in recruitment strategies. And I bring this up specifically because I know some of you at some point will be doing recruitment. So even just kind of thinking about what do you want and what are you going to be looking for? So definitely most effective is just making sure they're building that culture with annual engagement surveys and implementing recommendations from staff, competitive pay, both retention mostly retention bonuses and some sign-on bonuses, but they found that the sign-on bonuses aren't bringing in folks for the long term always. And so thinking about pairing those sign-on bonuses also with retention bonuses. Looking at continued benefits, student loan repayment, and then just providing that opportunity, the time, the funding, whatever it might be for that continued education. Least effective, as we already talked about, the employee-sponsored housing. Lots of work has been done there, and it hasn't always proved to be as effective. And thinking that pay solves everything. So recognizing that pay is important, but it also, you need to have that positive culture. And then sign-on bonuses being used for all positions versus just those hard to fill positions. We already talked about this a little bit, but some of the things folks really liked were those grow your own programs. So looking at CNA training courses, making sure the staff had the opportunity to serve as presenters and mentors, and bringing in those internship opportunities. Likewise, those pipeline programs, those high school medical career programs, and other components that are bringing and introducing folks to healthcare and their organizations at an earlier stage in their journey so that they have interest in coming to and staying with these organizations. I'm going to pause right there, and we're going to move first to a little interaction here from a standpoint of electronic interaction. So we're going to do a little survey. So if you can go to menti.com and enter this code, you can also use the QR code if you want to do it on your phone here really quick. I'll leave it up for just a second here. And what we would love to hear from you first off is just that piece of what is resonating with you the most in these results. So what did you hear that you're like, yes, I totally agree with that from these workforce assessment results? Thank you. Pay is not everything. I think that statement is definitely resonating across. Yes, work-life balance culture and managing that stress and burnout. I think that's a big one that we all have struggles with. The need for those internship opportunities, soft skills, that burnout coming from school and then entering the workforce while you're still burnt out. And that money can't solve everything. Yes. Great. I'm seeing some I'm seeing some key things you guys are honing in on. So definitely the stress and burnout piece looks like it's big, and that recognition that culture is a really big deal. I would love to also just pause right here to ask, feel free to unmute yourself. Is there anything else you want to share about the surveys? Is there anything that you feel like wasn't covered that's a really big deal to you? Yeah, Kevin.
Yeah, I just wanted to, I guess, give you a little data, recent data on the accuracy of what you're talking about. I just did a presentation to some Core 110 students yesterday. Dr. Patricia Fisher did an interview recently, and this is mostly in the mental health side of it, but and talking in her 12-factor model, how leadership, success planning, and employee wellness affects all the rest of the organization. But because of turnover and the baby boomers, so many of them retiring, creating these turnover situations, currently on average, what she's found in organization is 25 to 30% of employees meet the diagnostic criteria for clinical depression.
Wow.
40+% anxiety spectrum disorders, and over 50% are having serious sleep disturbances. So it really is significant what you were talking about.
Yeah. Thank you, Kevin. Those numbers are shocking. But does meet this. Thank you. And I think tells us we're in the right direction. Any other comments or anything you guys didn't see in here that is surprising to you that it wasn't a key finding?
So this is Elizabeth. So when you spoke about people needing to be ready to provide rural care, I came from DC, which when I came to Montana, everything was rural to me. Even Bozeman and Helena and Billings was just rural.
Right.
But I was informed, no, that's not rural. There's rural and there's rural. So one of the things that some people were honest enough to tell me is in some communities, I will not be accepted, not because I'm Black, but because I'm not from Montana. I don't know how to provide Montana care. So that's like really important. And I don't even know how to change that culture because that's not healthcare culture. That's culture, rural culture.
Right. Right. Yeah. Elizabeth, thank you for raising that. I should say Stephanie's taking notes of everything you guys are saying. So if you don't see me doing this, it's because that's what I have Stephanie here for, so we can capture this and see how to incorporate it. I appreciate that comment, Elizabeth. Okay. I want to dive a little bit into now our actual strategic planning and where we're trying to go now that we have these assessment results. The priorities that have been set forward as for this plan are listed here, and they've just been categorized. It's worth noting that in 2017, the first 4 categories were the same. And so the folks that have been working on this felt like that really captured quite a bit of stuff. We need to engage those partners. We need to work on recruitment and expand those pathways, but we still have to educate and train and then retain. The one piece that we're looking at adding to this that was not in the 2017 strategic plan is sustaining. And the group felt that this is such an important time for us to be talking about securing funding and resources, making sure everything is data-driven, that we have those evaluation pieces to show the impact of what's happening across Montana. So that is a new priority that has been added here. So as we go through these strategies, I'm actually going to pause on each one because I want to hear from you guys a little bit of anything you want to share, but really is there anything here that you're like, yes, keep that strategy. I feel wholeheartedly it should be there, to I don't know why that's there, seems less important, or you've totally missed it. Here's where your gaps are. So this is just a totally interactive time. We're going to go through all 5 of the priorities, review the strategies, and I just want to hear from you. It's our opportunity to get your point of view on all of these pieces. So I want to start first with the engage piece. And so there's 4 strategies here, lots of them really around just building partnerships. So looking at if you don't know what the Montana Healthcare Workforce Advisory Committee is, it is the group that's actually working on this strategic plan, and a group of partners from across the spectrum, from different healthcare organizations, associations, education, etc. And they'll be the ones really pushing this work forward. So continuing to expand their membership, to continue to look at those partnerships, particularly between employers, higher education, and training programs, so that we're moving forward with aligning on where we need to go. Looking at how to leverage partnerships to expand resources and funding. So some talk around like, can we do more joint grants together? Can we seek more funding opportunities collaboratively so that we're seeing this big picture together? And then just continuing to build other partnerships, particularly with this last strategy in those tribal communities. So I just want to open it up now to hear anything you want to share about these, good, bad, and ugly. You do not need to raise your hand. Just feel free to unmute. I'm not good at the formality, so just be informal with me. Okay. I'm gonna give it. Oh, Kevin,
Yeah, I'll
please.
just say, I think it's really well said, especially with the last bullet point that you've added. I can't imagine what else you could add.
Great. Thank you. I feel like this is a scenario where I'm gonna take silence from others to maybe be the same input as like, yeah, spot on, good job. I like good job. So I'm gonna move forward. This next one, recruit, one of the things you're gonna start to notice is we actually started to separate in the strategies a little bit into students and professionals because the strategy seemed a little bit different based on who we were talking about. So you are welcome to comment on any of them, but really, I want you to comment on the student ones to see if you feel like this is where our priority should be. So starting at the top one, expanding and enhancing those pipeline programs to increase awareness and preparation. Number 2 is really focusing on high schools. So outreach and partnership with high schools to connect the students to the training programs and start them in that pipeline. So including some job shadowing and internship opportunities. And then also that partnership with healthcare facilities to develop those shadowing and internship opportunities. I feel like I should add here that some of the feedback we've already received is that maybe this shouldn't be so specific with just high school students, that some of this is opportunities others could use along their own education paths wherever they are. What are we missing in terms of recruiting folks really into the healthcare profession?
This is more of a question. I sit on the recruitment committee for UM's pharmacy school, and we have been struggling trying to figure out new ways to recruit students. Have you guys explored any ideas on how to, increase outreach and get students interested in healthcare?
Yes, kind of. I mean, we've talked broadly about these strategies here with a big focus on starting kind of in the high school age and making sure that there's those job shadowing and internship opportunities available. So trying to hit folks kind of younger to start to choose that path along the way. I don't want to put Alexis on the spot, but if any, Alexis or Stephanie, if you can think of anything else we've discussed, please speak up.
Yeah, I mean, for AHEC, it's a big part of what we do. Our pathways and pipeline work is one of the really largest focus areas for us. So I think we're always looking to find new ways to reach students where they're at. We do in-person, in-school presentations, we do camps, we do, like Hillary said, job shadow, but there's always, different ways to do it that maybe we haven't tried yet that we are committed to exploring. And that's part of what this strategic plan is about, for sure.
Thanks, Alexis. Thanks for bringing that forward, Hannah. Any other thoughts on this? And I do want to raise, I mean, you guys are all going to go into the professional field side of it too. So there are those strategies at the bottom too, one around starting to use recruitment platforms. So really diving into some of the technology, software, et cetera, that's now available to try and utilize that in a manner that could bring in more folks, but also to start to look at both some best practices and innovative strategies. There was conversations around like North Dakota and some others have some really innovative things going on. I don't know what they are, so don't ask me. But that we need to dive into that a little bit to start to see what other states, particularly in rural areas, have started to do on the recruitment side of things. Any other comments or thoughts on this?
I think we'd be, sorry, Hillary, I just
No,
wanted,
please.
I mean,
Sorry,
this
I have
is
a
an
question.
area. Go ahead. I think
Yes, I
Eve,
just wanted to find out for the recruitment, is it a long term? Is it a long term or a short term plan?
So I think we're thinking the plan would probably be about a 5-year strategic plan. So remember, these are pretty overarching strategies. And what we are going to look at after this is like the development of some of those action pieces year by year for a work plan. Thanks. Alexis?
you can skip me. I've got a screaming toddler. Sorry.
Okay. Nope, you're good. I know you're at home. Okay. So next is the educate and train piece of this, which is basically where you all are right now. So want to hear from you on these. Bringing forward a strategy specific to training in those soft skills. Looking at creating some pathways specific to rural and frontier settings, and looking at increasing access to rural residency opportunities too. And some training tracks specific to rural. So big rural and frontier focus here because that was one of the main concerns we heard, along with some moving some apprenticeship and work-based learning models forward. On the professional side, looking at helping those facilities to be preceptors for this clinical education experience. So that last bullet is even around establishing a statewide, we're changing the words here a little, not really a recognition system in terms of you receive an award, we've recognized you, but more around like a voluntary designation for hospitals and facilities to say, we want to be a teaching and training site. We want to be provided that extra support to be a good preceptor, to be a good mentor, to provide good experiences for folks. So I'm going to pause here to see what everyone thinks of these pieces. What are we missing? Or what do you like?
Coming from pharmacy side, I really appreciate this. I feel like as far as our residency opportunities, they're all, Missoula, Great Falls, Billings, like they're bigger cities. And I personally am interested in rural ambulatory care. So I think that that would be a really great piece, especially with that like grow your own topic that you brought up. I think really increasing those opportunities for a wider spread of opportunities throughout the state, I think would be really helpful. And I think also that last bullet about the statewide recognition, like you hear about bigger cities having teaching hospitals. We don't necessarily have that because we're a smaller state. So I think having some sort of recognition or acknowledgement of, hey, this hospital, this facility is really awesome with students. Like, we want you to go here. I think, you'd learn a lot from that. So I really appreciate this slide, at least from pharmacy side.
Hey, Hannah, can you just tell me super quick, just so we kind of hear it and understand it, how do you find residency opportunities?
It's similar to how you would expect like medical school residency to be. So your fourth year of pharmacy school is all rotations. So you have 9 or so 6-week rotations throughout facilities. And during that year, you can apply for residencies. And then there is what we call mid-year. It's a big conference with all of the hospitals throughout the country that take residents from the pharmacy school. So you meet with them, interview with them throughout your fourth year, and then you match. So it's pretty similar to what, the stereotypical
Yeah.
medical school residency is.
And you're just seeing those larger hospitals in
Yeah, just
Montana
from what I've,
participate. Okay.
yeah, it's like community medical center,
Mhm.
Billings Clinic, the bigger hospitals. So I think it'd be really great to have some smaller rural access hospitals in there too.
Great. Thank you. Any other comments or thoughts on these?
Yeah, it's Evan. I think on the Master Social Work program, we have practicum in year 1 and 2, and developing those soft skills and education in that is really dependent on where your practicum is. And they're not all created equal for sure. And then, the comment that was made earlier about there's rural and there's rural, absolutely. We have some people up, in Havre versus Helena and some other smaller towns in that. And we have one student in Mexico that's doing a telehealth practicum to North Carolina. So, but it's kind of on the student to say, hey, I want to take the hard road. And it's easy when you're burnt out as a student to want the easy road. And that's going to get you, probably some of those comments in the end.
Thanks, Kevin.
I really appreciate the focus on the rural too, because I feel like as a nursing student, and I come from a really small town, I feel like a lot of people we talk about the disadvantages to rural health, but I feel like if you don't experience it, people don't really understand what it's actually like. It just feels like it's that couldn't actually be real, how disadvantaged it is. It just doesn't seem real, but they being able to experience it makes it more real, I guess.
Yeah, thank you. Great. Any other? I'm hearing we're definitely on track with putting a big focus on rural here.
It's very true what everybody has said with the social determinants of health. And I don't know if they have, I don't know, Hannah, I think she's a pharmacist student, immersion internships where you go to for 2 weeks and just live in a community where you can actually experience everything and provide care. I have a nurse who works right now in Tacoma at an IHS facility. And when she emails me, she always says the need is so great. The need is so great. And she's trying her best. And I just wish we had students who could impact those communities for not just 2 days a week, but for 2 weeks. And I guess that would be something like a collaboration with the schools and such, but I think it's very needed.
Yeah, thanks, Elizabeth. So more immersion, more time, but also immersion into the community itself too. All right. I'll keep us moving to the next one. So retain. So as we think about this from the student side of it, the focus was really on retaining students in the medical field. So retaining them in terms of finishing their programs and also retaining them in Montana. So having them serve here versus moving out of state or going elsewhere. So I just want you to think of that as you're reading this. So again, looking at those rural clinical training supports with the hope that folks that would then maybe be interested in retaining and staying in those communities. looking at the student well-being piece, so those mental health, stress, and burnout, and then actually moving some of our recruitment strategies to be intentional about recruiting folks into the healthcare field from some of the rural and tribal communities, with the idea of, if it's where you're from, that it might be where you want to go back to serve. And so finding ways to keep folks there. On the professional end, just looking at those career advancement pathways, having folks look at those innovative staffing models. So this is where things like flexibility, different hours, things like that can come into play, fostering those positive workforce cultures, utilizing technology again. So how do you utilize technology to start playing a role in retention too, which might be making folks' life easier, might be providing more resources, different things like that. And then diving in specifically to some of the needs, like housing is really the big one here, where, to be super honest with you, I think the survey brought forward that piece of what we're doing for housing isn't working. It's still a need. And so a lot of research and understanding still needed to even determine what exactly would be the strategies and action items for this. But first, we need to understand it a little bit better. So I just want to open it up again. Kevin.
Yeah, and I don't know if this is the right block. It does mention funding and opportunities. And, you know what, I was talking to a gal just last week in the year ahead of me, and the $50,000 student loan repayment program is what's having her stay rural. And I saw there's another, you can get an extension of 15,000, you know, that's after 2 years of full-time work. And then there's that extension for 15,000, which is kind of along the lines of your retention side of that. But, you know, that's still limited. Off the top of my head, I think that was doctors, dentists, and mental health. And expanding that, I would imagine would help. I know that's a lot of money, but, and what I don't have a good picture on is how short are we for healthcare providers in Montana? It sounds like
Yeah.
I don't know how much. Yeah.
Definitely short, yes. One of the assessments that's not completed yet, but should be soon, is actually an assessment specific to different professional fields and give some of that information, such as where are we short, what are we short on, and some of those like federally designated healthcare shortage areas. So there will be some more information on that, but I think a lot of it, I mean, if you look at openings, you can kind of see across the board, but really medical and allied health.
And you know, if we're short nursing, I don't see why we're not supporting nursing in that program, but we're supporting mental health, right?
Right.
See that expanded out.
Yeah, thank you. And loan repayment came up in one of our other listening sessions too, so I appreciate you bringing that forward again. What about others? What's keeping you in your program and what's going to keep you maybe here in Montana?
I do like this first bullet about increasing rural clinical training. It's like we had talked about, I think Briley brought it up, is like being immersed in that is really important. But with, at least for pharmacy rotations, like we do one after our first 2 years that are each 3 weeks long, and then 6-week rotations. Like coming back to the housing point, it's hard to find housing for 3 weeks or for 6 weeks. So trying to find, like, expand those opportunities, I think, is important to be able to provide those immersive, you know, rotations or whatever it might be in your profession. So I think that that is important, just to, you know, bring awareness to different communities and to hopefully bring students back there after they graduate.
Yeah, thanks, Hannah. Appreciate that comment. That for housing, we're not just talking about when you move there and get a job. It's also, if you want the experience, how you're going to stay there. Thank you. All right. I'll move to our last one. I'm just trying to make sure I'm given the opportunity to talk if anyone has thoughts. So our last area is really that sustaining piece. And so, as I mentioned, this is a priority that was added that was not part of the strategic plan last time. And so some of the things that have been discussed and are included here, one is to really start to understand the progression of students. So to understand if we connect with them in high school and they move to a college program and they move to post-secondary program, et cetera, like where do they end up and what programs have they hit along the way? And are any of those truly impacting that retention and staying in Montana and serving in the communities here? Thinking about ways to share promising practices and best practices and resources. So a little bit of that, like don't recreate the wheel, particularly for the smaller hospitals that might not have, or other small organizations that may not have the resources to like keep researching this and trying new things, that there's a little more sharing happening so everybody can continue to build cultures and do other things to keep people here. Funding is an issue. It's just always an issue for anything we want to keep going. And so in this case, AHEC is, I think I'm saying this correctly, someone can correct me if I'm wrong, but AHEC is basically federal funded at this point. And so knowing that that is all coming from one primary source, looking to bring forward some actual state funding for AHEC. So some of these programs and things like you guys are participating in can have more sustainability in place. I see the thumbs up from Alexis, so I got that right. And then really starting to look at clinical placements. And so looking at what other states are doing, how they're assessing capacity, how they're identifying gaps. It was interesting. We presented this at the Montana Healthcare Conference, and we heard both sides of it. Like we heard from one organization where it's like everyone's burnt out, they don't want more students, to another rural place that said, we would love students, how do we get them? To someone else saying, we're serving, or we have out-of-state students coming in, and so we're maybe not giving those opportunities to the folks that are training here in Montana. And so just trying to look at those gaps and really feel out how we can enhance clinical placements. I'll stop there and see what comments you all have.
So the idea of the statewide repositories sounds really, really good, and I will use it. It was there. And I apologize. When you were talking about the retention, I'm also with the Public Health Service, and we have they have a program, the Junior COSTEP and the Senior COSTEP. You may know about it, but I'm gonna put the link in the chat, and students can apply for it. They get money, they get housing, they get insurance, and then they can apply to be public health service officers when they finish the program. So that's another way, another retention way.
Thank you. Yes, please add that to the chat. We will capture that and take a look at it. Any other thoughts here?
I would just like to add that I think that this is a great category to have overall. A lot of times in public health, we work so hard to get people engaged in work, and then we're like, great, they made it, that's it. So just the sustainability and looking at like keeping people, funding, all the different aspects of what sustainability means, it's really cool to see this included.
Thank you. Yes, I agree. All right. I'm going to move us to our very last piece that is going to be interactive, and we'll do this on Menti again. So either going to menti.com or going to that QR code. There we go. It's up again if you need it one more time. Give it 1 second and then I'll get our question going. So our last question for tonight is if you could name one strategy, maybe it's one you saw, maybe it's one that isn't in there. What is the one strategy you want to make sure is included? Mental health, yes. Love this. So mental health again, student loans, and just even awareness about what opportunities currently exist right now. So being able to take more advantage of that. Yes, loan repayment, housing in rural communities. Rural again, making sure we have those rural pieces. Love it. Access to health education for rural students and relocating for higher ed can be really challenging. Clinical placement capacity and that long-term sustainability in rural areas. Thank you, thank you. Make recruitment events in high schools fun. Oh, thank you. Like have helicopters. I know, that's funny you say that. I actually saw the helicopter land at our fairgrounds and it was for a kids fair the other day and the kids were like beyond excited. So we got to figure out our helicopter in healthcare, right? Amazing. Thank you all so much. Just to kind of end, just to tell you where we're at and where this is going. So we're in the listening sessions phase of this right now. You guys are one of the listening sessions. We want to hear what folks have to say. We're going to be doing some broader listening sessions for healthcare workforce, leaders in the healthcare field, and then just continue to move these pieces forward to finish them up. If anyone has a need or a desire to be more engaged in this, as I said, that Montana Healthcare Workforce Advisory Committee is the one moving this forward. If that's something that you feel like a passion to join us on, there is a QR code here and you can provide your information and we'll make sure you get those invites to the meetings, as that will be the group really honing in on this a little bit more and moving some of that work forward. With that, I think we're like right on time. So I'm open to questions and also open to the fact that it is 6 p.m.
Thank you so much, Hillary.
Email me too if you have questions or other thoughts.
Yeah, thank you so much for putting your email there. And this recording will also go up on Canvas for everybody. It is 6 o'clock, so if you want to log off, that is understandable. But I will stay here and keep the Zoom call open, and we can ask Hillary any questions that we have. So thank you, Hillary, so much for such a wonderful presentation.
Yeah, thank you. Thank you all for your participation. Much appreciated.
Thank you.
Have a good night.
No questions. It must mean you crushed it.
Sure, we'll go with that. I like it. Awesome.
Great. Well, Hillary, thank you so much. Stephanie, great to see you. I hope you two have a lovely evening and we'll be in touch.
All right. Bye,
Sounds
everyone.
great. Thanks so much, Danica. Bye. Thanks. See ya.